Julie Gritzmacher, Aspect Program Director.
Welcome, everyone. I'm so excited to get this cohort started. You are cohort number 7. So about 165 people have come before you.
I'm a white woman. I'm sighted. I have long brown curly hair. My hair is kind of my defining feature. We had our first kickoff call last night for cohort 8. And so you all are part of cohort 9.
Tonight we have, it's myself and then I have 3 interns who are all Aspect alumni. The agenda is really just to get to know who else is on the call.
Celebrate the small wins. Celebrate the small wins. Relaxing.
Slowly let the light back in.
This is a co-creation. This came about because we were listening to all of you. And what we decided to focus on is what you came forward with.
Christopher Hord, writer-editor.
In the time that I've been involved in Aspect, I have met so many people, different ages, different backgrounds, different geographic locations, different walks of life, and I am dazzled and amazed by all the things that these people can do. And it inspires me and it gives me hope about the things that I'll be able to do.
Dr. Emmanuel Bolabo, optometrist.
Aspect has already made a huge impact on how I perceive patients. Number one, they're not just the condition that they have. You know, they're a whole human being behind the eyeballs, and they have other things going on too. It helps me to understand their perspective, their psychology. I think it's a whole cohesive thing that you have to look at. You can just, treat whatever they have at that present time. You also have to think about their mental health and things like that. So Aspect has really helped me out with understanding patients and being able to empathize with them and effectively treat them.
Elizabeth Edwards, patient.
What drew me to Aspect was the holistic view. I've come to really, really believe there's more to anyone than their disability, and an Aspect dealt with that and affirmed in me that I'm more than my disability. And hearing the stories of people, everybody's journey is their own. There are similarities, but everybody's journey is unique. But just hearing how people have navigated the story, I was like, oh, I could identify with that. And hearing what they've done with their lives has empowered me and affirmed more in me and reminded me that I still have a story. Because I thought I didn't have a story anymore, honestly.
Alumni of the Aspect Patient Engagement Program have gone on to contribute to drug development and research and have grown in their leadership through mentorship and community. Diane Marshall, patient.
When you lose your vision, you often feel that you've also lost control of many things in your life. I became a part of the Apellis advisory panel, which I am still a member of today. It was there we got to tell the different pharmaceutical companies the issues that those of us with geographic atrophy were dealing with. I also was interviewed by WebMD, Astellas, Johnson & Johnson, and Bright Focus. It made them realize what it is like to deal with vision loss on a daily basis. It has changed my life.
Dr. Leslie Nwankwo.
When Julie introduced me to Nanoscope, I was immediately captivated by the amazing work that they were doing to bring about a treatment option for people like me stricken with retinitis pigmentosa. After a series of meetings with Nanoscope, they invited me to join them for their next meeting before the Food and Drug Administration. This, of course, was extremely huge for me because for the first time in my life, I realized just how powerful sharing my story about my experience with a rare eye disease could potentially influence the approval of a viable treatment option for people with RP. This experience gave me a chance to advocate for something that is so personal to me. To know that my lived experience mattered and was instrumental in giving individuals on the other side of the table a real life perspective of what it means to live with blindness was so impactful to me. It also meant a lot to me to hear the CEO, the researchers, doctors, lawyers, and other members of the Nanoscope team express how my story not only served to propel them to the next phase of the process with the FDA, but also served to increase their motivation to not give up on the work that they continue to give their life energy to.
Lyle Carrera, Research Associate at the National Academies of Sciences, Engineering, and Medicine.
We reached out to Prevent Blindness to connect us with people who are living with visual impairment. We set aside a session dedicated to giving them the opportunity to tell their stories and discuss their experiences. The committee found their perspectives to be very insightful, and as the committee continues to examine the evidence and develop its report over the coming months, the lived experiences and personal perspectives that were shared will be a really important consideration.
Dr. Maya Sabatello, Associate Professor, Columbia University.
My research focuses on the equitable inclusion of people with disabilities in health and precision medicine research. My goal is to understand what people with disabilities, including blind and low vision individuals, think about health research and what are the barriers for their participation in such studies so that researchers can do a better job in including them in research effort. Blind and low vision individuals, like other people with disabilities, comprise a large health disparities population in the United States. They are less likely than sighted individuals to have access to needed health care or to forego medical care because of costs. As a result, they are also more likely to have preventable chronic health conditions and experience worse health outcomes. As part of my research, I have worked with Prevent Blindness to invite blind and low vision individuals to participate in my studies. I've also had a great pleasure to meet many of the Aspect graduates at the national meeting of Prevent Blindness, where we discussed advocacy, healthcare, and health research. It was wonderful to meet so many active and engaged community members who are invested in moving the needle towards a more inclusive and equitable world. It's been a great pleasure to work with you before, and I look forward to continuing our collaborations. Thank you.
Mentorship and Leadership Development. Nkemdelem Igwe, medical student, aspiring ophthalmologist.
Before I started Aspect, I was just working in Missouri at the time, trying to get into med school and really interested in ophthalmology. And lucky enough, I got placed in the same cohort as Dr. Constance Okeke, who was also one of the participants in eye health advocacy. So I was able to foster a lot of really amazing relationships. And I was also able to meet other people, some who look like me, who were in the field of eye care.
Zaze Owens, MPH candidate.
I'm now on track to graduate with a second master's degree next May of 2025 from Harvard. Julie has been supportive every step toward my goals, and I'm deeply grateful for her mentorship, the Aspect program, and the invaluable experiences that continue to shape my journey in public health and beyond. Thank you so much, Julie and Aspect program.
Dr. Shervan Polian, researcher, MPH candidate.
My time in the Aspect program has been really, really valuable to both my personal and my professional development. And I've been able to go one step forward and actually pursue a Master in Public Health degree in Health Management and Policy. And part of that decision to continue my professional training was really because of the Aspect program, because I came in contact with patients, caregivers like myself, advocates, leaders, and healthcare providers. It provided a very, very nuanced idea of the healthcare landscape, the challenges that are faced, and the changes that are needed on both a personal and a policy level. And so I've decided to pursue that degree in health management and policy. And I'm happy to say that I was accepted. I received this information this morning. But I was accepted, and for that, I would personally love to thank Julie Kretzmacher again, who was able to recommend me for that program. But even more than that, I would like to thank the Aspect program for providing such an invaluable platform for my growth and my development as a researcher and as an advocate. Thank you.